Hi, my name is Liz, and I'm a clinical pharmacist in Allegheny Health Network. Today, we're going to talk about how to use the FlexPen insulin pen. The FlexPen is a delivery device for Novolog and Levemir insulin, which are the brand names for insulin aspart and insulin detamir. These insulins are used to treat diabetes. The pens dial in 1 unit increment. The smallest dose you could give is 1 unit, and the largest dose is 60 units. There are 300 units in one pen. That's 100 units per milliliter, and the pens contain 3 milliliters each. The medication is given by subcutaneous injection, meaning under the skin. It can be given in the abdomen, thighs, or back of the upper arms. Levemir is administered 1 to 2 times per day, at bedtime or in the morning, without regard to meals. Novolog is administered no more than 15 minutes prior to a meal, up to 4 times daily. Let's get started. Flex pens are color-coded. The green pens are long-acting, and the orange pens are rapid-acting insulins. The pens contain the dose window, the dial, the injection button to inject the insulin, and the pen cap. Before each dose, check to make sure that the insulin is clear and colorless. If it's cloudy, roll the pen between your hands prior to injecting until the insulin looks uniform. You'll also have a pen needle and alcohol swabs. And you'll need a sharps container, which can be a detergent container, metal can, or a milk gallon. First, you'll wash your hands and remove the cap from the pen. You'll swab the rubber seal of the pen with an alcohol swab. Then you'll remove the paper seal from the pen needle and twist the pen needle onto the pen until you feel some resistance. You can remove the outer cap and save this for later, and you can remove the inner cap, which you can just throw away. Before every dose, you'll need to prime the pen. To do this, you'll dial up to 2 units, which you can see in the dosing window. And then you'll hold the needle over the paper towel or trash can, and you'll push the button down until you see 0 in the window, and you'll push the insulin out of the needle and out of the pen. You'll need to make sure you see the insulin coming out of the needle to know that the needle is primed. You might need to repeat this step until you see insulin coming out of the tip of the pen. Now you're ready to inject. Swab the injection site with the new alcohol swab. Then you'll dial up to your prescribed dose and inject the pen at a right angle to the injection site. This needs to be flush against the skin surface. Press the button to inject the dose. As you press, you'll see the dial go back down to 0. After you inject the entire dose, leave the needle inserted for 6 seconds, and then you can pull the needle straight out. Don't rub or press the injection site. You'll place the outer pen cap back on the needle and pull the needle straight out of the pen. Maybe. Dispose of the needle in the sharps container. You can never use needles more than once. Then you can recap the pen and place it in a safe place prior to next use. You can store the pen in the refrigerator before opening. You can remove the pen from the refrigerator 1 to 2 hours before using for a more comfortable injection. Once the pen is opened, you can store it at room temperature for up to 28 days if it's Novolog and for up to 42 days if it's Levemir. Common side effects include hypoglycemia, which is low blood sugar. You may feel dizzy, shaky, sweaty, irritable, or even lose consciousness. If you're having low blood sugars less than 70 or frequent symptoms of low blood sugars, talk with your doctor. If you miss a dose of long-acting insulin, you can take it when you remember if you're still within 12 hours of your normal dose time. Never double up on your dose unless you talk with your doctor. If you miss a dose of rapid-acting insulin, skip your dose and continue your normal dosing schedule, or call your provider for assistance.